As a gynecologist, we treat and operate on fibroids of uterus on a regular basis, but we realize that not much of patients have information about this. So let's discuss about fibroids of uterus today. Hi, I'm Dr. Deepthi Rahasya, consultant laparoscopic surgeon, cosmetic gynecologist, Sri Nandaka Advanced Surgery, Hyderabad. What are fibroids? It's a benign tumor, that means not cancerous tumor arising from single abnormal cell fiber of uterine muscle. So there's a famous myth saying smoking prevents fibroids, which is partly true, but you should also agree that it has many deleterious effects. So I personally would not suggest smoking for my patient with fibroids. What are the risk factors to have a fibroid? 1 is reproductive age group, which is 25 years to 40 years. 2 is obesity. More obese women tend to have more fibroids. 3 is the nulliparity, which means women with no child. 4 is long-term use of oral contraceptive pills. So now let's discuss about the symptoms of fibroids. Number 1, asymptomatic. The woman with fibroids may not have any symptoms at all. 2, menorrhagia, which means heavy menstrual bleeding. Bleeding prolonged more than 7 days or excessive bleeding even single day can be seen in women with fibroids. 3, pain during menstruation called dysmenorrhea is also seen in some patients. 4, infertility. 3 to 5% of women with fibroids may face infertility or subfertility, which means there is a low chance of getting pregnant. 5, pressure symptoms like increased frequency of urination or acute urinary retention. That means the woman can't pass urine at all, or chronic constipation, difficulty in passing stools, or have breathing difficulties in case of heavy, bigger fibroids. The huge fibroids compress the contents of the abdomen and the intestines, causing indigestion as well in some patients. The most common symptom being heavy menstrual bleeding, some women also think that is normal. So they present with anemia, which is low blood levels. So how do you diagnose a fibroid? Number 1, you have to go to a qualified gynecologist who takes a detailed history and then subject you to examination. Imaging diagnostics have a major role, and the investigation of choice is ultrasound. However, in bigger fibroids, we would suggest MRI. So what are the different types of fibroids and how do you treat them? So depending upon the position of the fibroids in respect to the uterus, they are divided into subserous, intramural and submucosal. The most symptomatic fibroids are 0 to 1, which are submucosal, which cause the maximum of bleeding. The most painful fibroids are intramural, which cause the maximum pain. And subserosal fibroids are usually asymptomatic. So, depending upon the size and position of the fibroid, the treatment option varies. For example, 0 to number 1, that is submucosal fibroids, have to be treated hysteroscopically, which means we insert a small camera into the uterus and remove the fibroids through the uterus downwards. Other fibroids like subserosal or intramural fibroids may require laparoscopy or laparotomy sometimes. To learn more about the treatment options of the fibroid, do watch the second part of this video, and the link is also in the description box. If you have more doubts, please write in the comment section and do share this video with female friends to spread awareness. Do subscribe to our channel and hit the bell icon to get more informative videos.